clinical slides for development, and make sure in the slides that you're going to write down the type of problem, what are the causes and main characteristics for each one. Okay, so these are all of them in the correct order, but I'll go through them really quickly. So this is an ultrasound. It uses ultra high frequency sound waves that bounce back, and it measures how far away things are, and you can kind of see the head of the baby and the hand right there. An ultrasound produces pictures, usually black and white or gray, but sometimes they're using color photographs now. Okay? This is the placenta. Remember that you have, the placenta is opposite than in the rest of the body, so the arteries have deoxygenated blood and the veins have oxygenated blood. And the placenta is where the baby's arteries, the baby's blood and the mother's blood are right next to one another near the chorionic villi, but don't actually mix. Okay, those are the placenta villi. There are 3 types of villi: primary, secondary, and tertiary. And around the 12th day, the cytotrophoblast cells penetrate into the cords of the syncytiotrophoblast, and they create the primary trophoblast villi. These villi continue to enlarge and create a network within an endometrium. The embryonic blood vessels develop within each villus, and where there, again, no mixing of baby and mom blood. Arteries and veins, make sure that you understand that the blood flow is to have nutrients go to the baby and waste go away from the baby. So there are 2 arteries and 1 vein. This is an ectopic pregnancy at around 8 weeks. Remember, ectopic pregnancy, fertilization occurs in the proper place, which is in the fallopian tube, but not in the, but implantation does not occur in the uterus. It occurs in the, anywhere other than the uterus, and usually in the fallopian tube. So the baby cannot survive in there, and once it ruptures, the mom is in danger of hemorrhaging to death. Okay. This is a premature infant. Usually anywhere between 28 to 36 weeks. They call it gestational age. Or in other words, less than 37 weeks. The newborn hasn't developed all its organs, especially its lungs. Remember, because the lungs are needed when the baby is in the amniotic sac. They're at greater risk of complications right in the beginning as soon as they're born, and sometimes throughout their entire life. Those are conjoined twins. So when you have a morula, sometimes the morula splits into 2, but if it splits and a piece is stuck, then here you can see where their 2 heads are stuck together, these twins. Obviously, if they're connecting the same brain, then they both can't survive if you have to separate them. But if they're separated, if they're connected at the hip, then if you can separate the hip, then one may have a hip and the other one doesn't, but they can both survive. This is called talipes, or clubfoot. You remember this from A&P 1, where the person is facing that way, they're facing that way, and this is their heel, right? And their toes have actually come this way and like in this way towards the back. So they're walking on the sides of their feet. This is a congenital deformity. Congenital means you were born with it, and you need to usually break that section and put casts on their feet. This is called microtia. OT refers to, way up here. OT means ear, IA means condition, and micro means small. So they have very, very small ears. This is a congenital deformity where the outer ear, remember it's called a pinna, is very small. Sometimes it can be absent. You can put maybe sometimes you can put a prosthetic ear. Have you stopped? Okay, this is polythelia. Polythelia literally means many nipples. So it goes along this nipple line, so this is just another nipple. This is a congenital anomaly. And it may look like a mole to some people, and usually does not release milk. You may remember this from AP1. This is syndactyly, where the fingers or the toes are stuck together. And this is polydactyly, where you have more than 5 fingers and or toes. This is a cleft lip, and here it is from another angle. This is after surgery, so it's been repaired by closing it. The cleft palate would be the hard palate, the maxilla inside. May happen, may not. They don't both have to happen. And this is an example where you can only barely see it at that point. And that's because the maxilla, when it was forming the roof of the mouth, there are 2 maxillae, and when they come together, it forms the roof. But if they form like this, then there'll be a big space. And that's where the oral cavity and the nasal cavity are not separated. This is called hypospadia. It's another congenital defect, and the urethra is not coming out of the proper place. So here you can see the scrotal sac, and right there you can see the urethra. So it's called a hypospadic urethra, and it opens anywhere along the line, right here, along this line, and doesn't come out of the penis. This is anencephaly. It's kind of hard to see, but right up here, the baby is actually missing a brain. So an means without, en means inside, cephala means head. So what's inside the head? The brain. So anencephaly means without a brain. If the brain stem is there, then you will have the baby stay alive on its own as long as you keep feeding it. But there is no conscious thought. This is called the meningomyocele. The hematoma is here in the back of the brain, and hydrocephaly means the head fills up with fluid. It's very rare condition, and in most cases, the cranium fails to develop. If the skull forms, it may be empty, and it could be translucent, enough where you can actually see light through it. Usually, death occurs within a few days or a few months after the baby's born. Here is another meningomyocele, but this is spina bifida, where the vertebrae don't close around the spinal cord, so the spinal cord is actually inside here. This is actually an extreme case, and they would usually be paralyzed from there down into the legs. The meningomyocele is the protrusion of the membranes that cover the spinal cord, and it's meninges through a defect in the vertebral arch. So if it continues to go through, that's the meningomyocele. If it's not going through and there's no big mass here, then it would just be spina bifida. This was Edwards syndrome, where you have trisomy 18. You know, trisomy 21 is where you have Down syndrome, but trisomy 18 is just where you have a third 18th chromosome. So it's a genetic disorder, and more common in girls than in boys. Usually it involves clenched hands, crossed legs, small head, low set ears, low birth weight. This is called Patau. This is trisomy 13. Okay, and again, it's another rare genetic disorder. It causes neurological, heart, and kidney defects. And you can see the typical cleft lip usually has a cleft palate in there. This is Turner syndrome. Normally a woman is XX, but in this case, it's X with a 0. There's only one X chromosome. This is breast cancer, carcinoma of the breast. This all is right here, which is malignant. So you can have different types of treatment. You can cut it off, right? Radical mastectomy, where you use radiation or chemotherapy. A lot of different techniques that they use today. This is an example of a mammogram where you can see carcinoma of the breast. But it's very hard because these things which are normal here, it's kind of hard to differentiate between those. I want to stop it. This is an ovarian tumor right here. Write down the common risk factors. Find it and put it in there so you can have it in your paper. Now, this is testicular cancer. Remember, cancerous things tend to get bigger, so this is a healthy testis, and this is an enlarged cancerous testis. This is the end of the penis. Remember, the enlarged part is called the glans penis. Okay, and this is showing you that you have a secretion. Gonorrhea is a common sexually transmitted disease. Here's another case of gonorrhea in a female, so you can see the outgrowths right here. This is syphilis in the male. You're looking at these right here. Now the syphilis actually has several stages. It's 3 stages: primary, secondary, and tertiary. And the primary one is where you usually have painless sores. But then later on, it will eventually reach the entire body. We usually give antibiotics, usually penicillin for this. But eventually we'll go to the heart, the nervous system, the skin, and the bones and affect everybody. That's it.